Epidemiology is the science for which public health is best known. It's the science that discovers patterns of disease in a population. We describe the patterns as the distribution of disease in a population. Personal characteristics of the sickened population are described. Who acquired the illness by category of age, gender, race, socioeconomic level, for example. When, that is, season, year, decade, did symptoms first occur? And where, zip code, county, state, country, did confirmed cases of illness appear? Epidemiologists look for risk factors. That is, what factors put these people at higher risk than the rest of the population for getting the disease? Risk factors include smoking, alcohol consumption, and a high-fat diet, to name a few. Then, epidemiology measures and gives statistical evidence of an epidemic, which means there's a greater than normal, greater than the endemic frequency of illness. Solving this part of the puzzle leads investigators to possible causes or determinants of the frequency of the disease. Identifying the determinants of a disease is called analytic epidemiology. Epidemiology uses results from analytic studies to control diseases. Medical and public health interventions are also used to prevent diseases from occurring in the future. Finally, epidemiology gives public health the tools to evaluate and analyze the success or failure for all kinds of interventions. You'd be correct to say that epidemiology is the study of epidemics. In fact, the science of epidemiology has its roots in infectious disease. You'll recall John Snow and his work identifying the cause of cholera outbreak in 19th century London. He mapped cholera cases and positions of local drinking water pumps, deduced that the Broad Street pump was the culprit behind the outbreak, and recommended that the handle of the pump be removed to halt the spread of disease. Based on his work, John Snow is known as the father of modern epidemiology. Epidemiology is still and will always be important in discovering the causes and controlling the spread of infectious diseases. The largest national and global epidemic of the late 20th century, one which continues to plague sub-Saharan Africa today, is HIV/AIDS. From unusual symptoms of emaciation, pneumonia, and red to blue-black skin blotches in an increasing number of gay men in New York City and San Francisco, epidemiologists discovered the HIV virus and ways in which it's transmitted. Medical scientists and pharmaceutical companies came up with effective drug treatments that today allow patients to live long and productive lives with the disease in remission. Importantly, public health practitioners have drastically reduced transmission of the disease by educating the public about prevention methods, including the practice of safe sex. Practitioners have also educated the public about harm reduction methods for drug users, for example, using easy access to clean needles. In addition to infectious diseases, the focus of epidemiology has expanded to include chronic diseases and health behaviors, which in our modern society contribute to the greatest morbidity, that is, sickness and disability, and mortality, that's death. Examples include lung and other kinds of cancer from cigarette smoking, as well as coronary heart disease from high cholesterol, high blood pressure, and smoking. Epidemiology is also used to evaluate how effective public health programs such as smoking bans and cancer screenings are. The definition of epidemiology includes not only diseases, but health-related states and events in the population. That means that epidemiology is used to study both positive states, say the prevalence of immunity or physical activity, and negative states, such as the prevalence of obesity in a population. Population stresses that epidemiology focuses on groups of people. This differs from clinical medicine, which focuses on individuals. Many people find careers in epidemiology. So what do epidemiologists do? They perform a number of activities important to promote the public's health. They provide the scientific basis to prevent disease and injury and promote health. Help establish priorities for research and action. Identify populations at greatest risk in order to help target interventions. Evaluate the effectiveness of programs in improving health or preventing disease. Study the course of diseases. Conduct disease and injury surveillance, and investigate disease outbreaks.